So today we're going to break down two critical studies that analyze the outcomes of nearly 2 million cancer patients. The data is really clear and the findings are, frankly, disturbing. This isn't about shaming anyone, it's about giving you the evidence you need to make the best, most informed, and most effective decisions for your health. It's definitely something to consider when you're thinking about what cancer care to get, what to refuse, how to weigh those things, and how complementary or alternative medicine really stacks up. We've already covered several of these in different categories, and we'll do more episodes on specific CAM treatments in the future. What these two studies did was to lump together all non-conventional treatment as CAM and analyze the outcomes. This loses a lot of detail that we'd love to have about specific treatments. It gives us a very solid overall readout. And that result isn't good, but it's really interesting. And it moves us from that absence of evidence and evidence of absence for any beneficial effect. So the first study looked at partials. These are folks who did any complementary medicine along with any conventional treatment. And they looked at people who chose CAM alongside conventional, whether people taking that CAM refused some of the conventional treatments. They looked at overall outcomes, they looked at who chose CAM, and they compared all of these. So these 1.9 million patients were diagnosed with either breast, lung, or colorectal cancer. They were followed for over a 10-year span, and they were matched for age, cancer status, overall health score, insurance type, race, and cancer type. Pretty well controlled overall, though it could have been a little more carefully controlled for obesity and metabolic diseases because we know those are factors. So when comparing the outcomes between those who used any type of complementary medicine and those who used no complementary medicine, those who chose complementary medicine were twice as likely to die within 5 years. Think about that, twice as likely to die in 5 years. That's a really big and really negative effect. And it would be really good to know why that's happening. Fortunately, the authors dug deeper. It turns out that many of the people who chose complementary medicine also refused some or all of the conventional treatments. On average, the refusal rate for chemotherapy, hormone therapy, or radiation was between 30 to 50% higher for those who chose CAM. They substituted complementary medicine for conventional. That refusal, the decision to skip a proven treatment, makes a massive difference.